Marc is a very sweet and caring young man. He has a lot of strengths, a wonderful sense of humor. He's very personable and articulate. He loves people.
To tell someone about Marc, I would say he's got a big heart. He really does he tries hard to help people. He's genuine, he's smart, he's funny.
Marc was a normally developing boy residing in Timmins with his mother, father, and brother. Just before the age of 14, he started to develop some visual problems, headache, seizures. This led to the diagnosis of a craniopharyngioma, type of brain tumor for which he had surgery at the Hospital for Sick Children.
The reason why Sue is walking to my left is because on my right-hand side, I'm visually impaired, so I need the support, the visual, you know.
So this way you see me and don't bump into me. If I was on the other side, you'd likely bump into me.
Yeah.
That surgery left him without a pituitary gland, and so some deficits in his hormones, as well as some visual problems, so only partial vision in his right eye, as well as some cognitive, behavioral, and emotional problems.
It was just like, why me? Why me? You know, why not Daryl? Why not Johnny? Why me? You know, and I kept telling Mom, I said, Mom, bad things happen to good people. You know, I says, life ain't fair. She says, no, Marc. She says, you have to move on. You know? She says, you can't think about all the negative things in life. You have to move on. You know, so I says, okay, Mom, okay. So when I moved to March Dimes, they gave me services almost around the clock. So we're gonna go up to the 4th floor, and we're gonna turn right, or left. Left, and we'll go right down the hall where it says March Dimes, and that's where the group is. Lots of groups going on here.
Good morning.
Here's one of my friend Alan. And without them, I wouldn't be where I am, because they've helped me a lot. With my past, I've learned that I gotta live for me now. You know, the past is the past. Yes, I had straight A's. I was a hockey player. I was a baseball player. I had a girlfriend that was potentially getting married and having a future. But you know what? Live for today, not for tomorrow. 9, 10.
When Marc had left here, I think given the complexity of some of his difficulties, we would not have been surprised if he had ended up being re-referred to hospital related to an aggressive episode or having difficulty with law enforcement, and that has not happened. I hope that, you know, I think a lot of this is attributed to Marc's effort, the work of his frontline team, but, you know, I'd like to think that our support adds a piece to that as well.
Marc had a very successful discharge. We see that many individuals that we discharge from hospital often relapse and come back in for treatment. And Marc is a success story because he was successfully managed and recovered very well in the community, and I believe that was through the partnership with Ontario Shores outpatient services and also with the March of Dimes. One of the unique services we have is OTN Invite, which allows a person such as a doctor or a care team to use their personal computer or their laptop to send an invite over email to a client or a patient such as Marc. He can then click on the invitation and connect securely and privately, and this enables him to do that from the comfort of his home.
OTN gives great opportunities for us to network across the Northeast. March of Dimes has outreach programs in a lot of towns in Northern Ontario, and having access to professional services. And also we also use it between our sites as well, because we have some of our expertise within our own organization is here in Sudbury, and then we can also collaborate with people farther north or farther east.
As a psychiatrist, I think that the quality of the therapeutic alliance is one of the, if not the most important factor in treatment success. And I say that, irrespective of whether someone is taking, 0 medications, 1 medication, or 5. I think the therapeutic alliance is a key determinant there. Without this technology and the infrastructure to support it, we would not have been able to maintain this with Marc. And part of that also relates to his cognitive deficits. I think we simply would have faded in his memory as well. So meeting regularly with him, knowing where he's at in his life and his development has been really helpful in allowing that to really bloom. I've continued to see Marc in follow-up through OTN really every 2 weeks to 3 months, depending on what's happening at the time with him. When things are stable and he's doing well, we will touch base every 3 months for a follow-up appointment through OTN, really to check in, look at his medications, make sure he's tolerating them, try to anticipate any difficulties that may be coming up in the future. When things get a little bit bumpy, as they can for any of us when there's stressors in life, for Marc, we try to increase the frequency of the appointments and follow up a little more closely.
Dr. Gafar, my mood is not, how can I say it? I feel very, not suicidal, but just depressed. I don't feel like doing nothing, or just, oh, well, let's go to the gym. Well, I hate the gym.
So really kind of negative.
Did you ever have someone or something to look forward to? Well, to me, I look forward to talking to Dr. Gafar, because Dr. Gafar is not someone that's going to say, shame, shame, Marc. He'll tell me what I did wrong, but we're going to sit there and try and fix it, And really, it means a lot to have him still as a doctor and as a therapist. He understands totally where I'm coming from, and it's nice. It's nice to be heard and to be listened to.
The feedback that we get from users is actually very, very positive. What we find is the video connection, the visual, being able to contact with a person visually really lends itself well to the mental health field. You're still able to make a relationship with that person, interact with them. In fact, as a mental health practitioner or clinician, you can actually see a lot and assess a lot just by looking at the presentation of a patient. You're able to use OTN within a team function to do team conferences. So really it does bring that personal aspect of care to the person, even though they may not be there in person, and certainly better than it would be over the telephone. OTN really is unique in the way that it can connect care right across the province through multiple sectors and through multiple areas within the healthcare system. Recent data shows that OTN has prevented more than 200 million kilometers in travel. We've been able to reach over 185,000 patients and save the province about $70 million in travel costs alone. Plus, it also provides ease of access. It can help with waiting lists and dealing with delays that often people deal with in the healthcare system.
It was nice being at home. You know, I'm at home. Hi Joanne, I'm at home. You know, it just feels nice to be able to communicate with doctors and therapists at home. You know, not having to run to a hospital for maybe a 1 hour meeting, you know, so it's nice.
I've been working with Marc for quite a few years, 10, 12 years now. Okay. And my hope when I first started working with him was that he could be a young man who had a life, who lived in a community, who could see some of his dreams come true. And there are challenges. He faces challenges every day. But to be able to learn from him and to see him grow and to see him have friends and have moments where he doesn't have to always know that he has a brain injury, that, you know, he can just be Marc and not focus on his challenges. That's what's rewarding at the end of the day.
I agreed to do this because I'm hoping that one day this will open new doors for brain injury, new doors for OTN, because communicating with Dr. Gafar through OTN has helped me a lot.